Well, news of the reforms being put on hold came right before World AIDS Day. With more on what this means for the community, we're joined in studio by Muluba Habanyama, an advocate and director of communications and programs at the Ontario AIDS Network. Thank you so much for being with us today.
Thank you for having me.
So December 1st, the Awareness Day. It's already happened, but it's really important to keep the conversation going here. And I want to start with just trying to get some background here. So you were born with HIV. You're an advocate. You've dealt with the stigma. Maybe let's start with talking a little bit about why someone who is undetectable chooses not to disclose.
Well, there could be several reasons. So first, starting with they're undetectable, so they're not at risk to anybody else, right? And so looking at myself, who's been living with HIV my whole entire life as a Black woman, it may be because of to prevent violence, it may be because of my own privacy rights, knowing where my status will go to, and maybe also because it doesn't really feel like it's somebody's business, especially if I'm not putting them in harm's way. So there's several reasons why somebody may not want to disclose their status that I think we should recognize in Canada, and especially if they're undetectable and not at risk. Why should they have to disclose their status? It feels like you're putting the onus on them, where actually all of us, if we're sexually active, should be responsible for our own health.
And so what's your reaction to, the Canadian laws related to overcriminalization of people with HIV?
It's really disappointing. I was born in '93. These laws have not changed since the '80s. I met with the Attorney General earlier this year. We were really hopeful. Part of the coalition, we were very hopeful that these laws would be changed or at least a little bit of reform. Just to see Canada backtrack and just stall again has been very disappointing to me personally, just because it feels like there's been so many advances. As a child, I was taking 6 pills twice a day. Now I take 2 pills once a day. And so to see those advancements in science, but not in the law, it's very disappointing. And now I know as myself, as a woman living with HIV, that I am still at risk of getting criminalized. And I still am told by my country that I am a danger to society. And that really hurts.
How did that conversation go with the feds? Are you hopeful? Are you making any strides, you feel?
I was very hopeful. I have to be honest with you. I was very hopeful for the years that we were having the conversations with the feds. Felt a lot of feedback, but in the fall, really that conversation broke down when they weren't reaching back out to us. We wanted kind of that conversation. And so now my hope definitely has dwindled. I don't want to lose all hope because I'm still an activist and I'm doing this work for a reason. But I really call to action. They open those communications up and really do make a change because I'm still very hopeful, but very disappointed, I have to say.
And so this is all happening at a time where we're also seeing a rise of HIV cases here in Canada. Yes. The Public Health Agency in this country recently released numbers, and I believe that they said that there was last year a 35% increase in new cases. Yes. Do we know what's behind that? Could it be more awareness, more testing? Can you maybe talk a little bit about why we're seeing this rise?
All of the above. So we actually have some great testing methods. We have self-testing. You can get tested at the pharmacy. It doesn't have to be like back in the day with just your family doctor. There's so many methods, but for several reasons, people are scared to get tested. There's not that awareness of what HIV looks like and how that risk for HIV. So it is quite shocking to see a rise when it's like we have so many preventative methods. We have PrEP, we have testing, but how is it getting accessible to communities, especially those communities that are most vulnerable? So seeing that rise is quite scary, but I do believe we have the tools to really decrease that rise. But I do have to say, Canada is not doing its greatest compared to the other countries in HIV rises, and I think that's for several reasons. Criminalization has not changed. Supervised consumption sites are now being shut down, which those save lives. So we're not doing anything for harm reduction. We're not doing anything for people living with HIV. The people that can be at risk and should get tested, I don't think that they want any parts of that.
You touched on it a little bit here, and I want to bring it back to World AIDS Day too. That just passes, but there's really an important theme here, a critical one that does speak to a little bit of what you mentioned. Take the rights path, my health, my right. Yeah. What does that mean, and how does it apply to us here in Canada?
I think what it means is that it's your health right to know what your status is. It is your right to decide what path you want to take with your health. And I think here in Canada, where we should have the accessible tools, it's giving people the option that is available to them. There's so many options that are available when it comes to HIV treatment and HIV prevention, but it's making sure that people are aware of these options are accessible to them, and they are given the dignity to make these options and giving the respect, and that's what we really need.
How are we doing on the awareness front?
We could be doing better. We could always be doing better. Part of the work that I do with the Ontario AIDS Network, for the Canadian Foundation for AIDS Research, is doing a lot of awareness. So I feel that we are doing what we're doing, but sometimes it gets a little siloed. So something when we talk about undetectable, I wonder, okay, do we know as Canada what undetectable means? Is that just something that I talk about within the HIV community? So we need to do much more awareness just with the general public, and a lot of awareness with the young people, with youth, because they did not see the HIV pandemic, right? And so they don't know what it looked like in the past or what it looks like now. So we do have to get out there and do that awareness and still talk about safe sex methods and HIV and what that looks like and testing.
Okay, Muluba, thank you so much for coming here speaking to us about this. We appreciate it.
Thank you so much for having me.